Hello and welcome to this channel, Clinic Wahala, by yours truly, Dr. Catch. Last week, I believe, the world celebrated or talked about hepatitis. Hepatitis is a word that should not be strange to people because you may or may not have seen one or two people that have hepatitis, but you need to know the truth that it is here with us, especially in Africa. It is here with us. It's around, very much around. You may be surprised that someone you know may have hepatitis, but you don't know he has hepatitis. So it's something that is noteworthy. It's something that you and I are supposed to take a bit serious. Yes, hepatitis, there are many types of hepatitis viruses. But I know that the one that usually disturbs, or the one that is so common in and around us, is hepatitis B. So basically, somehow they said some of the hepatitis, they can be transmitted from poor hygiene. The people that will stool will not wash their hands and use that one and go and chop food. That can happen. The ones that go through, they call them fecal-oral. That's from stool to water or food, and you eat it and it becomes a problem. Whereas hepatitis B and some of his brothers are mainly passed through fluid from people, secretions and fluid from people. So it's important to maintain very good hygiene when you are dealing with people, especially health workers and those in the labs and all that, dealing with people's samples and even at home. Yes, it's important you maintain good hygiene around it so that you don't go and infect yourself with what you don't know. Are you aware too that hepatitis is sexually transmitted? You're supposed to hear that one. Whenever we talk about things transmitted through sex, people will jump to AIDS and all. But hepatitis is very much transmitted through sex. So you should be wise and you should be careful with the practices you make. Yes, because somebody will be here. Many people know that he got hepatitis because he was sick. They gave him blood and it went through. That one day, but it's not always the case because most medical facilities screen blood. So that also goes to my fellow people in the health sector. We need to be thorough when we screen this blood so that if it's positive for hepatitis, we can remove that one and not infect somebody. It's important. But I bring news to you hearing this thing today that it's not just about the blood that they transfuse to somebody. It could simply be because you had sex with somebody who had hepatitis. And while you are busy trying to dodge bullets from HIV, hepatitis will just carry you. And funny enough, hepatitis is a stronger virus in quotes than HIV. Hepatitis can stay on a surface for long. HIV, just without blood and all those things, bam, it will just die. Ordinary homo and all those things will just knock it off. But hepatitis can stay on the surface for days. At room temperature, it can stay for days. It's actually a hard man. So we need to give some consideration to hepatitis and not just HIV and other things. So know today that is sexually transmitted. If they do anyhow, they do anyhow. Know today that is one of the sexually transmitted disease. No be when you open radio, they tell you staphylococcus, streptococcus. Those ones are not even it. Those ones are not it. Hepatitis is one of the sexually transmitted diseases and you need to be very careful about it. Hepatitis is bad in the sense that when it gets in and your body does not clear it, because truly, in fact, the records say that a third of the world population may have come in contact with hepatitis, but because our immunity is sound, we don't develop long-term infection, we just clear it. So, but some people also are not able to clear this virus. It will just go somewhere, go pack. At a point in time in life, it will get reactivated and start causing problem. One of the bad things about hepatitis is they call it predilection. It loves to go and harm the liver. So it's a very clear cause of liver failure and liver cancer. So that's why there is a global outcry. There is vaccination done globally. There is this global education for us to do this vaccination for hepatitis. Vaccination helps us a lot because it will help you produce soldiers against this hepatitis B in particular. So when they come in, when the virus comes in, these soldiers are already ready with their spear, their gun, their bazooka to destroy the virus when it comes. That's the essence of vaccination, and it's very important too for people who their immunity is low, or those that work like me, that work in health institutions where we handle samples, see patients that are sick with this kind of diseases. It's good we protect ourselves and my true self. I'm not sure I don't complete my own, but that's by the way. That's by the way. It's about 3 doses over a 6 months period. There's a regimen, there's a way they organize it. So even normal people do get these vaccines. Children always get these vaccines. So when you have kids and all these people that are busy dodging vaccination, it's important that they get it as part of their routine vaccination, so that when they are growing, they won't have problem when this thing comes. So but truth be said, most of the people who have hepatitis problem as adults, most of them they were infected when they were children. So many is usually from a mother that had hepatitis and didn't know, now gave birth to a child. Most of the time it's at that stage that the virus seeps in and relaxes up to a point where, as the child keeps growing, it will now start showing himself, doing anyhow. So most times it's usually from mother to child. That is the truth about hepatitis B infection in particular. Unlike some people who may now think that is mainly as an adult through the practices we do that we got it. We get it as adults, but not as much as children, because as children, immunity is actually a bit lower than adults. Adults can fight it somehow with their immunity. Children may not be able to do that initially. So when their immunity starts getting strong, it now sees the virus where it's hiding and starts destroying the virus, thereby harming the tissue, and wahala will start. So that's how it usually happens. But that one is story for another day. So it's important that we get vaccinated to protect ourselves, and these vaccines, most times when we get it complete, is lifelong. It's important to be safe. Don't just go and be sleeping around and unprotected. In particular, it's not only HIV that will buy you, hepatitis B can destroy you too. So we also need to avoid sharing of sharp objects. You don't go and use needle with somebody you don't know. You don't go and even clipper, those things that can cut your skin, razor blade, tattoo materials, pedicure, manicure, all those things that can cut your skin and breach that protection your skin gives. It can allow this hepatitis. Don't go and share it with people. Then, like I mentioned, for the hepatitis, the group that enters from the dirty hands and what we eat, those ones you need to wash your hands and wash them clean. Whenever you want to eat, wash your hand. I've done video about hand washing. It's one of the most important treatments in this whole world, so it's important that you do that. I've already talked about the health care workers. You need to be thorough when it comes to screening the blood and the products you give people, so that you don't go and affect them. Then for those who are listening to this and already have hepatitis B infection, you need to be careful so that other things that affect the liver will not do combo. They will not do tag team and go and destroy your liver with hepatitis. Hepatitis is capable of destroying the liver. Don't go and join something like alcohol to now go and destroy from this side. Hepatitis will come from the east, alcohol will come from the west. Same way, it's not only alcohol that causes liver damage. Even for some of us who have small obesity, if your weight is not proper, if you're overweight or obese, you need to bring down that weight, because there is also something they call liver disease from not alcohol related. Yes, so that one can also cause problem. So it's important that you know these few things about hepatitis, so that you can also be informed and inform others. Thank you very much for listening. Do well to like, share and subscribe. Send this thing to your young people so that they will also learn. Thank you very much.